So it was a lot of green. Yeah.
The eyes are the windows to the soul, an expression that is often used to describe the deep connection one feels when looking into another's eyes. However, their importance is solely placed on how we view the world. For the first few months of her life, she couldn't see the bright jewelry that she has gotten to love or the green color that she has gotten to dislike, which, according to the mother, could be because the hospital where she stayed, personnel wore green uniforms to work.
We tried to let her get used to all the colors because, I mean, Namibia after rain is so nicely green, so she must get used to green. But yeah, she's going to school as well, so they also practice with her eyes because at the moment she still her eyes is still looking skew, and so she still learns to use her eyes.
The 1-year-old Marianne Grobler was born with OP corneas on the 19th of February 2016. The little cheerful baby girl couldn't sit still as she kept fidgeting with the objects around the table. Surely, her interest in objects around her became more obvious after the groundbreaking operation performed by Dr. James Aquavella, a corneal surgeon in the US. The Boston keratoprosthesis is an implantation procedure that involves full thickness removal of the cornea and replacing it with an artificial cornea.
We removed her cornea. We implanted a valve, it's called an Ahmed valve, which prevents pressure from building up in the eyes so she wouldn't get glaucoma. And then we took out the cataract, we took out all of the iris, made a little bit of shelf, and we implanted a special telescope which was bound in by some human tissue that was obtained from the Tissue Banks International. And then after that was done, my vitreoretinal colleague, looks through this 3 millimeter in diameter optical telescope and examines the whole of the retina and reinforces the periphery of the retina with laser treatment.
Dr. Aquavella, who says, although I can't save them all, I try my best to give back the gift of sight, is in Namibia to follow up on Marianne as well as meet up with ophthalmologists in the country and assess the situation of those who are visually impaired.
But at least if we can develop a system of triage so that we can at least make a diagnosis, and sometimes it's just as easy as taking a cell phone picture at the front of the eye, getting somebody to try to check the vision, just to read the chart maybe, and getting somebody to take a quick pressure to see if there's any glaucoma. Just those 3 simple things, we can probably do an awful lot.
The Groblers have now taken it upon their might in assisting the many that are robbed from the gift of sight. They are thankful to the Pupkewitz Foundation for helping them in assisting their daughter to go through the operation. And thus, as their token of appreciation, they have set up a trust to help others who might find themselves in the dire need to assist their children with the gift of sight. Their first action is to gather frames to donate to people who are visually impaired. For NBC News, I'm Elmarie Kapunda in Windhoek.